Today we're going to talk about Protocol CT1, the Intervention and Medication Administration Cross-Check, or I-Macc. This protocol is designed to protect patients and clinicians from medication and treatment errors. It is a three-step process that creates a consensus of what is an appropriate treatment for the patient. The first step is simply announcing the medication or intervention. The clinician performing the procedure or administering the medication states what they plan to do or what procedure is being performed. The second clinician will then confirm that it is appropriate for the patient and that there are no contraindications. After that, we move on to step 2. In step 2, the administering clinician will verify that the concentration, volume, and route of the medication, or that the location and equipment choice for the procedure are correct. The administering clinician will also confirm that there are no contraindications, and the second clinician then confirms the appropriateness of the intervention. Step 3 occurs just prior to the intervention or medication administration. Here, the drug name, volume, and dose are all visually verified by both clinicians, or if there's an intervention to be performed, equipment size, setting, and procedures are all correct. When all 3 steps have been completed, the medication can be given or the procedure take place. Remember, it takes 3 to go and 1 to say no. It is important to remember that we I-Macc every medication and procedure and that everyone is involved in this process. This includes EMTs, as often there's only one paramedic on scene. EMTs need to be familiar with what is in our bags, in the MOMS protocol, and any contraindications that may arise. Here is why we use the I-Macc. In 2020, there were 47 reported errors, 16 medication, and 31 procedural. Any of these errors may have resulted in a negative outcome for the patient. Here's the big one. EMTs and paramedics alike should know the landmark for IO access. If the performing clinician is missing the landmark, I-Macc should prevent the misplacement of the IO. So what if something does happen? The 47 clinicians that reported errors in 2020 did the right thing. CS10 says that online med control consult shall be made if medication, treatment, or transport error or patient injury has occurred. Do not be afraid to own your mistakes. By owning a mistake, often the outcome is better than just getting caught. And reporting errors in real time to online med control gives you the help you need that may be able to help reverse an adverse patient outcome.